My name is Margaret Denise Mills. I'm a family physician and I have been practicing family medicine since 1999. What I enjoy most about family medicine is the opportunity to take care of patients in the ranges from birth through end of life. I get to see them in good times and in bad, and get to serve as a distant relative, a counselor, a therapist, an advocate, in addition to being their medical provider. I have 3 areas of clinical interest. The first is OBGYN, because up until 2018 I was delivering babies, and that's how we start with young families and we continue all the way through. And so although I'm not doing delivering babies anymore, that's still a very keen interest of mine. And then adolescents, because they're practicing to be adults. And so the medical office setting is a great opportunity to allow them to practice having their own voice and thinking about their bodies and their health and what's important to them. And then end-of-life issues is the third area of interest, because all of our lives eventually end in death. And because family medicine is based on relationships, we have those relationships with our patients and are able to talk about fears and talk about priorities and quality of life versus quantity of life, and to help be the voice when they don't have one. So the running joke in my family, my maiden name is Richardson, and so my initials were MD and DR. So as far back as I can remember, my dad said, "You were named to be a physician." What I didn't realize was just the opportunity to be constantly learning, constantly growing, and never being able to predict what was going to come into an exam room. And so I chose to be involved in medicine to help people to never get bored and to always be learning and growing.